Hi everyone, and welcome to our webinar. My name is Lauren May with Iatric Systems, and I will be your moderator today. We have a few housekeeping items to go through before we start. First, if you should need any technical assistance during the webinar, you can head over to the questions section in your control panel or reach out to me via email. If you have any questions about the content of the webinar, feel free to ask them at any time by again submitting your questions in the questions section of your control panel. Just so you know, we are recording for quality purposes. And at the end of the webinar, there's a survey you can take. By taking the survey, you will be entered into a drawing for a chance to win a $100 Amazon gift card. The drawing is held at the end of each month. Next slide, please. And now I'd like to officially welcome you to our webinar, Do You Know Who is Accessing Your Organization's Medical Records? Thank you all for attending. Next slide. Today, we have two guest speakers from CynergisTek. Marty Arvin is the VP of Compliance Strategy. She brings extensive experience in operational and executive leadership in the fields of compliance, research, and regulatory oversight in academic, medical, and traditional hospital care settings. Michelle Drake has served in healthcare as the privacy officer of a large physician-owned practice, a medical technician within the United States Air Force Medical Corps, and a Medicaid Managed Care Provider Relations Account Manager. She currently resides in Austin, Texas, as CynergisTek's Manager for Managed Services. We also have Tim Burris presenting from Iatric Systems. He is the Product Manager for our Patient Privacy Solutions. He gained much of his background in privacy and information security from the United States Air Force and while working for Houston Healthcare in Georgia. And now I will hand it over to Marty.
Good morning, everyone, if you're like me and you're on Pacific time, or good afternoon for those that are on the East Coast. We've got a pretty full agenda for the webinar, so we're going to move through this fairly quickly, but we want to touch on just some of the regulations and the guidance we've gotten from OCR, the OCR enforcement actions around this topic, how to build your program, what kind of data tools you might be looking at, how do you assess the risk, communicating the message, just a sample audit program, and then the use of technologies in this process. So what are the regulations and guidance on access monitoring and auditing? And normally I wouldn't do this, but I did put the specific regulations in here because I think it's important to really parse out the language that's in the regulations. And these are under the security rule. And it says a covered entity or business associate must implement policies and procedures to prevent and detect, contain, and correct security violations. So it's really that detect piece that we're looking at in talking about access monitoring and auditing, and thinking through how are you going to try to detect those security violations. And then another provision of the regulation says that the organization has to implement procedures to regularly review records. So one of the things that Michelle's going to talk a little bit more about is regularly review. But as you can see here in the regulations, we don't have a specific time frame or definition around that. But the expectation is that you would be looking at your information systems activities, such as audit logs, access reports, and security incident tracking reports, to try to identify and detect where those security violations might be occurring. Another provision of the security rule says that there's an expectation that the organization will implement hardware, software, and/or procedural mechanisms that record and examine activity in the information system that contains or uses electronic protected health information. And again, you notice I highlighted record and examine. There's an expectation that not only do you have the logs being created, but that those logs are actually being evaluated in that regular review process I talked about in the prior slide. And another important factor, and again, Michelle's going to get into this in a little more detail, but it says the information systems that contain or use electronic protected health information, or EPHI. So it's also going to be important that you are doing this for all your systems. Most commonly, what I see is that organizations are doing it for their electronic health record, but there really is an expectation under the regulations that you're doing it in all of your systems that contain EPHI. And at least what I've reviewed and seen, that can be the real struggle for organizations. So that's something that I think should be considered and evaluated, and some risk assessment done on whether or not you have the capability and functionality and resourcing to do it across all systems. But we've heard from OCR in other contexts that lack of resources alone is not going to be something they would take into account if they identify a security violation that could have been detected through this routine monitoring and auditing. We do have a couple of OCR guidance documents, and so I've referenced them here and given you the websites, and I'll talk a little bit more about each of these. So the OCR 2017 guidance said, when determining reasonable and appropriate audit controls for information systems containing or using EPHI, covered entities, business associates have to consider the risk analysis results and organizational factors. So you're not just saying, well, we're just going to audit and monitor anything. You can define it and tie it back to what are the risk factors as a result of your risk analysis process, and looking at things like your current technical infrastructure, hardware, software, and security capabilities. But the important thing here is that you document that. If you've got multiple systems with EPHI, and based on your risk analysis results, you've decided not to have functionality in one of those systems because it's a small system, maybe it's used by a limited number of individuals, and you believe there's much less risk of security violations through improper accesses there, then that may be your rationale for not doing any auditing and monitoring of that system. But the critical factor here in doing that is to document why you made that decision. Because if that system, I'm the former Chief Compliance Officer for the UCLA Health System. We had a significant number of very high profile individuals come into the health system. And if for some reason their data got into one of these smaller systems, and we had elected not to monitor the accesses to that system, and somebody improperly accessed it and sold data to TMZ, let's say, I don't think OCR would have looked favorably on that, because that clearly was a substantial risk for us of improper accesses to individuals of interest because of their celebrity status or status of another nature. So again, those are things you'd have to think about in this process. The guidance also talks about how it's imperative for covered entities and business associates to review your audit trails regularly. Again, they don't tell us what regularly means, but I don't think you could say we do this once a year, and OCR is likely to consider that regularly. Maybe if you do it once a month, maybe if you do a process. And again, Michelle's going to talk more details about the actual structure of the program. But that's where, again, you have to have some solid basis for how you've defined regular, because it is a regular review of information systems that should promote awareness of any information system activity that could suggest a security incident or a breach. And then some Q&A questions covered entities should consider from OCR. What are the audit control mechanisms that are reasonable and appropriate for you to implement? What are the audit control capabilities of your information systems? And I think this is an area that you should be asking vendors. If you have vendors that are creating and maintaining protected health information for you, do they have audit trails and access control activity within those systems? I previously encountered a vendor that we said, when we asked them in our due diligence, do you generate audit trails? They said, no, we don't have any functionality or capability to do that. And it happened to be a vendor that was going to be utilizing and creating and maintaining a fair amount of EPHI for us. And we indicated that we would not proceed with the deal until they could demonstrate that they had that capability, because we felt like it was that important. And if you have a vendor that's going to be maintaining that kind of EPHI, like maybe a third-party billing company or a transcription service or something of that nature, you may wish to assure and want to do some due diligence to make sure they actually have some functionality like that, or make a business decision that you're okay with the fact that they don't, and take that risk that there could be improper accesses and there would be no way to really monitor and audit to them or even identify them if there needed to be an investigation. Looking at, do the audit controls implemented allow the organization to adhere to their audit control policies and procedures? What changes or upgrades of any information system audit capabilities may be necessary? And again, that goes back to my example a moment ago. What if that business associate wouldn't have been willing to commit to that update to the system, we were not going to go with that vendor because we felt it was that significant. And again, if we had elected to go ahead and go with that vendor, we would have made sure we well documented why we thought it was okay to do that, or at least assure that the senior leadership understood the risk of continuing to use that vendor, given that they didn't have those types of controls in place. The HIPAA Security Rule Education Series also talks about this a bit, and these are the papers that OCR published back in 2003 and then updated again in 2007. But again, information system activity review enables covered entities and now business associates is something I added to determine if any EPHI is used or disclosed in an improper manner. Again, information system activity review procedures may be different for each covered entity. So it's not a one size fits all like many things in compliance. It is really looking at what's appropriate for you in the context of your organization. So if you're a community hospital in a small community where everybody knows everybody, you may be wanting to look at employee accesses to coworkers and family members, because when someone gets admitted to the hospital that may be well known in the community, that doesn't mean that your workforce members have the right to look at the record of that individual, even if they're very well intentioned in doing so. Sample questions again: what are the audit and activity review functions of the current systems? Or are the information systems functions adequately used and monitored to promote continual awareness of that activity? What logs or reports are generated by the information systems? If you're implementing new technology today, that I think is something you definitely should be asking. What can the system do? Are there policies established that reviews will be conducted? And, you know, again, this is one of those things, if you have a policy that says you're going to be doing these types of reviews and you're not doing them, that is a problem. Trust me, as someone who's been through more than one OCR investigation, they look at your policies and procedures and they will ask what you're doing in those areas. And if you're not following your policy, that will be something that they will question you further on. And again, are there procedures that describe the specifics of how you're doing this process? And it doesn't have to be down to the nitty-gritty detail, but there should be some context around what it is you're going to look at and look for. But again, as you look at your policies and procedures, you want them to be flexible enough that you can adjust your activities through the years as your risk profile might change based on your ongoing risk analysis. I just want to touch on the one instance of OCR enforcement that has occurred that we're aware of. Remember, there are many resolutions that OCR has that are more informal and don't get to the settlement phase to result in a resolution agreement and corrective action plan. But in this case, the allegation by OCR in the settlement was that the organization failed to implement procedures to regularly review records of information system activities such as audit logs, access reports, and security incident tracking reports for approximately a year and a half. It affected at least the records of 80,000 patients. The resolution agreement and cap settlement was for $5.5 million, and it resulted in a 3-year corrective action plan. And as I understand it, based on what's publicly reported, this was an instance where the organization wasn't appropriately monitoring their own employees, but they also weren't appropriately monitoring the employees that they had allowed access to the system for some of their affiliated physician groups. So it's not only looking at your own employees, but who are the third parties that you have allowed to access your system. So that is definitely something that you need to think about as well. So I'm going to add one more thing before I turn this over to Michelle, and this relates to a presentation that Ileana Peters, who oversees enforcement for OCR, gave earlier this year. And one of the things she talked about around this topic, these are some of the enforcement activities that OCR she identified that they're pursuing, and one of those was lack of appropriate auditing. And she suggested that organizations might consider looking for things like access to PHI during non-business hours or during off time. So if I normally work 8 to 5, am I accessing information at 10 p.m. in the evening? Access to an abnormally high number of records for ePHI. So if I normally access 50 records a day, am I now suddenly accessing 200 records a day? PHI of persons for which there's a significant media interest. It may be celebrities, it may be sports figures, but it could also be someone who's maybe involved in a significant accident in your community that happens to come to your facility. It may be, for example, we consider gang members as persons of interest at UCLA because we recognize that there could be, retribution and people wanting to know how the person's doing, where they are in the system to perhaps pursue retaliation or other types of things. And then, of course, access to the PHI of your employees, accessing coworker information, either for good intentions or for malicious intentions. So, again, that's the kind of thing that OCR is expecting you're evaluating and looking for and determining whether or not you need to do this type of access monitoring. So with that, I'm going to turn it over to my esteemed colleague, Michelle Drake, for her to talk to you about building your program. Michelle?
Thank you so much, Marty, and hello to everyone on the call today. Some key things to think about as we bear in mind all of the regulatory insight that Marty has shared with us is the importance of a plan. Why is it that we should plan? Well, the simple piece is once you have a plan, you can then map out the framework for next steps, really have your call to action, and take the time to really bear down on the strategic elements of your program, the framework of your organization, and commit some time to that strategic planning. And with that plan in mind, you'll have your call to action essentially. You'll have those results of what are the priorities for the organization and what are those key elements and priorities in terms of 1, 2, 3, for example. Let's get the team all going down the same path at the same time. As decisions come up, as decision points always do, you'll have that reference tool to fall back on in terms of, well, per our plan, these are the following key elements. So that should help all the necessary folks involved in decision making with the bringing it back again to what was our plan as of this date and time. Thinking about aligning strategic resources, effective communication. And as we think about that plan and what's the end note of where we're going with such a plan, let's think about what we do from a standpoint of programmatic reporting. So if our plan is that we want to go ahead and frame up an audit program in response to various said security rules so that our organization can demonstrate compliance and adherence to, then we want to be able to say in November of 2017 to our leadership, CEOs, C-suite, the board, in October of 2017, for example, we conducted 2 proactive audits that resulted in, following our analysis, we had approximately 10 findings that necessitated the incident handling program being followed. From those 10 findings, 8 resulted in a breach. Of those breaches, the sanctions ranged from employee education through termination of that employee from the workforce. So some type of statement is what you're looking for from a programmatic standpoint. So to think about beginning with the end in mind, that's what you're striving for. What's the plan to get to the ability to be able to make those programmatic statements? If you already have that in place, fabulous. For those of you that are working to mature your audit program, we have some key elements to think about. For others that are thinking about setting up your plan, think about your starting point. Where is it that you are and where is it that you're going? What's your current state versus your future state? So you want to kick off your audit program perhaps to take it from a predominant reactive or responding to complaints to more getting in front of things with proactive and planned and scheduled audits. Think about your timelines and your future phases so you can map out your plan and think about it in terms of first quarter of 2018, second quarter of 2018. Here's our intended outcome by the first quarter of 2019. Make it monthly, make it weekly. Of course, you know your organization best, so know what timelines would fit best with those. With the plan comes framework. So all of us, well, I shouldn't say all of us, I'm an HGTV nut. I love home and garden television. And as you think about framing up a house, let's say, you have to have those strong supports. You have to know where those load-bearing walls. Chip and Joanna Gaines are always wanting to knock down walls. Well, you have to know what are those key critical pillars within your program that you can't knock down and or you need to be able to speak to. So we're going to touch on tools, resources, and processes. And with that strong framework, know that we're focusing on not just today, but tomorrow and years to come, building that strong program. So thinking about the tools, let's think about what's in your toolbox. So this is talking about tools from the perspective of what types of tools do you have to implement and or run your audit program. Things like software. It could be as simple as an Excel spreadsheet as you manage your incident handling program. Perhaps you have an organization with a more robust tool, such as a governance, risk, and compliance tool, where you document all of your program elements from policies, procedures, incident handling, trends and analysis, things of the like. Others don't have such a robust program, so that Excel spreadsheet can be your absolute best friend. Thinking about your audit tool, are you looking at an audit tool and utilizing your internal resources, such as we run all of our audits out of our native EHRs, or are you looking for an external audit tool where you would be consulting with a vendor and looking to see what is the functionality, as Marty was speaking to, with the vendors that offer those audit tools? Some organizations have disparate EHR systems, and they need to think about an audit tool that can pull them all into one, so that throughout the last 3 years with our mergers and acquisitions and our 10 hospital systems, our last 2 acquisitions had Epic, everyone else is on Cerner. We're putting them all in together in a future implementation, but for today's purposes, how do we run those audits? Do we need to think about an audit tool that can meet those needs for the organization? So with the next piece, what about resources for your program? Do you have an initial ambassador that's been your program champion, or do you need to go find one and help kind of champion your ambassador and give them those talking points? These can be the secrets to your success as a compliance, privacy, security officer, is have someone other than you that's singing the same song, that's that ambassador within the organization. Help them understand what the intended program results are going to be. What are those programmatic metric reports going to result in, going to show and or currently illustrate, and have them help you share that message up to the board and trustees of the organization. Let's think about establishing who is the program oversight. Oops, sorry, another couple components on that. Thanks, Marty. So with regard to who has oversight for the program, who is it? Is it the chief privacy officer that owns the auditing and monitoring program for the organization? Who are the players on the team? How broad is the team? Is the team just the privacy team and the compliance team? Or have we also thought about our other team members within the organization, such as department heads? Perhaps you have multiple hospitals and you want to, or you currently have privacy representatives at each of your hospitals. Your HR liaison from an enterprise-wide to also HR liaisons at each hospital or clinic, for example. You also want to define the roles for the team. Does everyone know where the handoff points are? Do they know who all the dedicated resources are? Have you thought about desktop exercises if you're stepping up your new program? Think about a couple of sample findings from a recent audit report and do a couple of hypotheticals. Run those through a desktop scenario so everybody understands their roles on the team, how they have to hand it off, and what the next person would need, so that we're not doing duplicate efforts and working smarter, not harder, for example. We want to think about internal, external resources, or maybe both. Maybe you have plenty of resources in-house to manage this program on your own. Fabulous, rock on. If you need resources, if you need to add in more, as you're framing out your plan, you're going to have that framework to know where the gaps exist, where you might need those external resources, and or if you're going to be hiring from within. It goes back to that framework, knowing the pillars, knowing the resources, so you can map out your case points for what you need to enact an effective program. So moving on to the pillar of processes. This is something that I would say could be enhanced for most organizations, which is you have your tools, you have your resources, you've mapped out your steps, for example, and do you have your processes written down? Does everybody know it? Could you, if OCR were to walk in the door and you wanted to speak to your program, could you show them your workflows and your processes as it relates to how we escalate findings, how we provide notification, how we document all of our processes? Do you have those processes written down? Could you do something as simple as some of those beautiful bubbles and flowcharts and have those workflows written down? Create some swim lanes so that you have handoff points on, here's everything that one person does, they hand it off to the next team. You think about a soccer game, how do we get the ball from, scooting across the field? How many players need to touch that ball to get it into that goal and get it to the finish line? So think about your processes in terms of who needs to touch that document, that patient, that record, that handling of incidents, so that we can get it across the line to the goal line. With regard to scope, as you're mapping out a program, you always want to ensure you know where are we in terms of our purpose. What's the purpose for this program? What are we intending to achieve? When we think about auditing medical records, what we're essentially trying to do is know if the controls that we have in place in our organization are working. And how can we demonstrate if they're working? Well, we need to audit around and find out what maybe isn't working. So let's say that we had a policy in place to say that if you're going to look at your own medical record, the way in which you do so is to go in through the organization's portal. Well, a way we can demonstrate that that control is working is we run an audit to see who's looking at their own medical records directly in the EHR versus going through the portal. So again, you can map out your audit program around the scope of what are the current controls in place, or what are we intending to do as we have it mapped out within perhaps our code of conduct for how folks are supposed to abide by the rules when they're in that medical record that they've been provisioned access to. How are we analyzing the data? We're going to go into that further as we think about processes for analyzing that data. Defining your key terms. You know your organization, you know what those terms are. As you think about building your program, enhancing your program, and maturing your program, does everybody else know what those terms are? So as you're putting together those future programmatic reports, you have your audit, your monitor, your findings, your breach, incident, escalation. All those metrics and terms are things in which you're going to help educate the members of your team, leadership, and the board on, so that they can speak to it as well when asked, and it becomes part of everyone's vocabulary. You want to be able to have metrics that outline things such as hospitals and departments and what goes on. So how do you do that? It's got to be all about the data. So the devil's in the details, as they like to say. How do you know what the data is telling you? The data really tells the story. What's going on in your medical records? Are you like some that are thinking, well, I don't know what's going on, but I have all these suspicions? Or do you truly know the activity that's going on in your medical records? So if we think about your data, you have to first start out with kind of it from a 30,000-foot view. Do you have a landscape where you have 50 disparate ePHI applications with 15,000 users that are provisioned access to those ePHI applications? You know that your primary applications are these top 5, and that's where the bulk of your users are provisioned access. Do you have that, and do you have your arms around that knowledge? Do you have that comprehensive list of what all of the ePHI applications are for the organization? If the answer is no, then you need to think about getting that list. You need to think about building out your own Excel spreadsheet, if you will, and knowing what are all the applications that the organization has with ePHI. Are some of them in-house, homegrown? You want to know about everything, all the software elements. You want to know the user count per application. How many users are provisioned access to PACS, for example? Of those users, where are they? Are they from certain departments within that application? Are they from certain hospitals? Are there disparate users, some business associates, some folks on payroll? What type of data is in that application? Who's the application owner? Who's your go-to person when you have to conduct an audit on that particular application, for example? Have your go-to guide already assembled so it's there for you, because this is your future roadmap as you think about really expanding on your audit program. And also, not only what that second bullet there on what EPHI applications are included in the tool and which are not. If you're choosing to go with an audit tool or you currently have one, I think a key element to highlight is here's what we're auditing that's in the audit tool, and here are the other EPHI applications that are not in the audit tool, and here's why not. Document that risk assessment that you've conducted as to why you've chosen not to put those applications into the tool, and/or consult with your vendor on how you can add those into the tool. Because when you have those audit tools, you can then run a report and be looking at data from numerous sources. Also, think about the timeline. If you don't have them mapped in and you intend to, create an associated timeline and/or map out that documented business case. So moving on from that to the data, let's think about the users. Let's think about learning more about the users. This is something that as we're thinking about those multiple systems that you're accessing, not all users are identified similarly in those disparate systems. So it's really critical to know how are users provisioned access. Do you have users that are in Epic, for example, that have all the elements there? We know the name and the job title and the home address and the date of birth, et cetera. But then when we're looking at data from another system, from eClinicalWorks or from another system, it doesn't have the job title, for example, or I don't have my supervisors or no departments, or when I'm provisioning access to new business associates, what are those mandatory data elements? As your audit team is looking to run these audits out of your audit tool or your native systems, you need to be able to identify and map out those elements. As Marty was speaking to with OCR saying, what are those high volume access points? How are you going to be able to make the statement to say, I know that the typical average volume for all folks that's job title is a nurse is we typically have a typical job, or excuse me, a typical number of patient records that a nurse looks at is approximately 150 a week. And that way I can set it so that those that are outside that and look to filter out which are greater than 150 or lower than 150. So I can see my normals and abnormal activity. Well, if you don't have all of your users provisioned with mandatory fields, you won't know all of your nurses, for example, because not all job titles are in there. If you have nurses that are hired on as business associates, perhaps that's a bad example, but trying to drive home the point, you want to make sure as your provisioned users are in your various systems, your elements for all your users are also similarly mapped so you can speak to all of your data and not have those data gaps that you're going to have to look to fill later. But know where that is, know what it looks like, find out, ask those questions. And similarly with the user data, almost apply the same standards to the patient data. How are patients set up in the various systems? Know what all of those patient identifiers mean so that as you're analyzing the data, you can make correlations between user activity and patient activity. Are the locations of the patient and the locations of the user, are they set up and are they mapped well so that you can run those reports and look to see who might be accessing medical records of their coworkers, because everything tracks very well within your system. So let's move on a bit and talk more about risk in general and getting your arms around everything. Some organizations have an excellent set of documents and they have it all together and everything's there. However, other organizations might find that there's certain documents that are on their to-do list. It's on my work plan for 2017, didn't quite get to it yet. Think about your team. Do you have an org chart that outlines your audit team? Does the organization have a policy or procedure that maps out what the audit program should look like? Do we have policy that speaks to how employees are supposed to look at their medical records so that as you think about setting up that audit, is it already outlined in policy what you're going to be speaking to? As we think about industry best practices, having that written framework for your program is obviously going to put you in a really good position if you're asked to speak to your program and provide any documentation on or around your program to an outside source and or internal. Maybe you need to speak to that as well. Also knowing how to lean on those internal resources as you think about that accessing that patient's medical record, that last bullet there. So we want to think about how to look into to, has someone looked at their own medical records? This is a really great starting point for an organization, and we'll touch on this in just a little bit. We have a sample audit plan to show you. But if you think about running an audit on or around, did users look at their own medical record? The highlight of that particular one as a starting point is that looking at your own medical record isn't a breach. Rather, it's a policy violation for most organizations. So to start with that might be a really great kicking off point for your program if you're looking to kind of get it started. You can lean on a bunch of different folks within this process. So as we think about kicking off that program, you could maybe create a form letter for those that were found to look at their own medical records. Lean on your friends over at HR that you've already decided on the applied sanction. Have them send out the form letter on your behalf, on the organization's behalf, and then you can really kind of integrate all of your resources within your organization, create those internal resources. This could be your first desktop/real-time exercise as you're taking your organization to more of a proactive approach to auditing and monitoring the information within the medical record. So additionally, with regard to risk, let's think about when was the last annual assessment and what were the findings from that assessment? Because this is excellent to bring into what is your audit program. Did we have risks that were identified on or related to what happened at one of our hospitals or a specific job title that we want to ensure is incorporated within our future audit plan, so that you can use this as framework when you're mapping out next year's audit plan, for example, which reports to run when, which audits to run when, based on known risks to the organization. If it's not known yet, perhaps all the findings from your first year's activity when you're mapping out next year's audit program are going to help frame up 2019, for example. You want to think about how different user groups are provisioned and or those risks that the compliance, privacy, and security professionals want to incorporate within the audit program. So now let's change it over to communicating that message. Taking all those ambassadors, everyone that you've brought into your program, and really getting the messaging out in multiple ways. This is all going to be embedded within your program, thinking about timelines, when you're going to be doing all these activities. How can you educate the workforce? Perhaps you just started a new tool. You're going to kick off your program and take it up to that next level. Sending out a message to the workforce, letting them know that we've enhanced our audit program. You'd never want to speak to, we just got a new tool, we weren't doing this before, now we're doing this going forward. Use a term such as enhanced to speak to how you're maturing your audit program. Maybe you want to remind them of a particular policy when you're sending out that communication to your workforce. Maybe you in turn want to send a similar message to your business partners, that is they have the provisioning of access to certain EHR applications at your organization. Maybe you need to send a similar message to them about the enhancing of the audit program. Create those business partner relationships as they need to escalate those findings. It can be an excellent kind of win-win getting that program framework started and enhanced. Additionally, think about your department meetings, your leadership meetings. Is everybody aware of where we're going, what the program metrics are speaking to? What are some key metrics that we need to include in dashboard reports? Do we know what those are today? Can we speak to our leaders and learn what is it that you would want to learn? If you don't know what metrics to include, go start having those conversations, letting them know what the intended outcome should be and see what their questions are so you can kind of get ahead of the curve when you think about your future dashboard reports, and or dovetail in your existing dashboard reports with your enhanced program reports if you're going to be adding in these future matured proactive audits. Also documenting and establishing the frequency of when you're reporting to the board. You may not be reporting to the board yourself, perhaps your reports go to the board, but having that documented so your program has that defined on a quarterly basis, the board is made aware of the findings from the preceding quarter, for example. Also, to think about what we're doing with all the program findings. As we have those breaches that are discovered proactively through combing through the data before we get the complaints in the privacy team, for example, how can you take those findings, use some of that great scenario-based training that works so well with new hire training or annual education to the workforce, and really kind of make sure that you have always current information on how you're sending out your messaging to the workforce. The Chief Privacy and Security Officer may want to meet to assess, once we looked at last quarter's findings, for example, Are our current controls meeting the needs of the organization? Do we need to reassess? Do we need to create a mitigation plan based on those findings? So let's think about our sample audit plan, putting all the pieces together and really looking at how could this and how does this look? You want to determine what types of audits. How frequent do you want to run those? What is this part of an annual audit program? Do you need a quarterly? Do you need a every 6 months? Who's the approval body? Is there a standing approval that it needs to go to so that if we're framing up next year, for example, by the end of October, do we need to make sure that we have the 2018 audit plan already primed up and ready for review and approval by the board or by the compliance review team, for example? And then let's look at what one might look like. We've got 4 months here. We have our audit period. When are we going to conduct that audit? Well, in January of 2018, let's run an audit to assess for the employees looking at their own medical records. Let's look at December 2017 data, and let's look at the entire month. You want to think about, as you're setting up your audit plan, what resources do you have in place to manage the results of each audit? Do you need to look at an entire month's worth of data? Could you think about smaller sample sizes, such as one date of service, 5 days consecutive, 15 days consecutive? Do you want to increase the sample sizes as you go through the course of the year? So you have so many variables that you can build in here with your audit program, being cognizant of the known risks that you found through your risk assessment, pulling in all the key elements from your program, getting that feedback from leadership, feedback from your organization so that you can, as your organization's chief privacy, compliance, security team, really be the framework for and the voice of where you're going to go forward, what we know about before the complaint hits the hotline. We're going to get in front of it. We're going to take our program from reactive to proactive and shed some light on things. So now I'd like to turn the wheel over to Tim, and Tim Burris will be going over the use of technology.
Thank you very much, Michelle. So when it comes to building an auditing program, and when it comes to getting the wheels underneath you in regards to establishing your policies and procedures, looking at how many members of a team that you have to conduct your auditing, looking at what type of audit program that you want to run, there ultimately becomes a balancing act of scope versus outcome, or versus resources. So we have the scope and the outcome of what we want to do, and we have to weigh that with the resources that we have available in our organization. So Michelle, of course, spoke to building your auditing team, and she spoke to a number of fantastic best practices in regards to privacy and security auditing. Now, there's all those things we want to do, and then there's what we're ultimately capable of with the resources that we have available. And that's where technology comes into play. Technology is the key to balancing the scope of the program you want to have with the resources that you have today. With limited resources, if you want to be able to view more, do more, you're going to need some effective technology solutions. Next slide. And this is where Security Audit Manager comes into play. Iatrix Systems has developed an award-winning solution that helps organizations balance the scope of that privacy auditing program in a way that really helps produce results. So to begin, it will help you receive and consolidate audit log data from multiple sources. You're going to have the ability to bring data together from your EMR, your PACS system, lab systems, billing and registration systems, any sort of system that houses that protected health information, any of those systems that are within scope of your program, we can pull all of that data together. We can also supplement that data with user and patient demographic information so that you're going to have everything you need to conduct an audit at your fingertips behind a single pane of glass. Of course, not only will that give you the ability to conduct quick, thorough privacy investigations. If there was ever a reported concern, if there was ever something you needed to investigate or follow up on, you're going to have everything you need to conduct that follow-up in a timely fashion. But it also gives you the ability to proactively monitor for privacy violations. And what that means is that this tool is engineered to help your organization spot suspicious behaviors that are being identified in the audit log data. So if a user went into a patient record that they're not necessarily supposed to be in, whether it be a neighbor, a family member, a coworker, their own record, the record of a VIP or a high-profile individual in the community. The system is built to identify those accesses and make them stand out. And as it relates to that scope, balancing that scope and that resources, it's a very effective tool at finding suspicious activity, but it also helps you to prioritize those findings. Security Audit Manager leverages analytics that are going to help us rank and prioritize audit findings. So the most important items will bubble to the top of the list, those items that are the most risk to your organization, those items that represent the highest percentage of accesses by a potential malicious user, and those items that are most likely a true positive as opposed to a false positive, so you're not going to waste time spinning your wheels. So those analytics help to prioritize your workflow and control your ability to look at the most important incidents first. And one of my favorite features is the ability to tie it all together with Security Audit Manager's integrated documentation. We have the ability to document incidents, take those incidents all the way through a thorough investigation process, and we can identify if those incidents constitute a reportable breach. If they're a breach, we can also document the breach notification actions, and we can give you comprehensive reports on whether you have satisfied the Department of Health and Human Services online breach notification requirements, which breach notifications are still pending, and so on. For these reasons and more, Security Audit Manager has been recognized as a leader in patient privacy monitoring by KLAS for the last 3 consecutive years. And I knock on wood here, but as we're rounding out the end of 2017, we have a strong lead to bring down our 4th consecutive year as the leader of privacy monitoring in the industry. So as it comes to building those audit programs, you of course have to select a good team. You have to understand the policies and procedures. You have to understand the regulatory requirements, but you also need good tools in your arsenal. Security Audit Manager can serve as one of the most valuable tools that you have for detecting and reporting and documenting inappropriate access in your organization. Next slide. Now I'm going to go ahead and turn it over for questions. If you have any questions for me about Security Audit Manager or for Marty and Michelle on things like OCR requirements or program best practices, you can go ahead and enter those questions in the chat pane of your GoToWebinar window, and then we'll go ahead and respond to those questions accordingly.
Thanks so much, Tim. We do have a question. Our first question, I believe, is for Marty. It is, what is an example of a system other than the electronic medical record that contains PHI?
So your billing system, your patient billing system, where everybody is coding and submitting those claims, is not normally under the definition of your electronic medical record, but that system would very clearly contain ePHI. You may have a PAC system that you may not define as part of your medical system. Some organizations I've seen do, some don't, where the actual images are stored. That system is going to contain ePHI. And you may have research records that if they fall inside or part of your covered entity or part of the covered component of your hybrid entity, that would still be PHI, but those are not records that are being kept as part of the traditional electronic medical record. And those are just a few instances that I can think of where you might have individuals accessing information on a routine basis, but it wouldn't be part of what is known traditionally as the electronic health record or the electronic medical record.
Thanks so much, Marty. Our next question is, will Security Audit Manager also audit dictionary access and changes made if integrated with Meditech?
Absolutely. So as Meditech is constantly being enhanced and new releases are submitted, some of those releases do constitute changes to their audit logging. We try our hardest to stay abreast of those changes and work with organizations to make sure that all of that audit data is captured in Security Audit Manager during their transition or upgrade processes.
Thanks so much, Tim. We have a few more questions. What is the typical number of proactive audits we should run per month?
So I'm going to comment, and then I'm going to let Michelle comment, because this is part of what she does on a fairly regular basis with a number of our clients. But for me, if I look back at those regulatory provisions, it just says you have to do the reviews regularly. And of course, we don't know, obviously, what that necessarily means for OCR. They've not published any guidance that says that means once a month, once every 2 months, once a week, daily. So it's not 100% clear on that. But if you think about what regularly is, then perhaps once a month would get you a pretty good starting point on that. But again, that's tied back to your risk analysis. Where are your key risk areas? As I mentioned in my discussion, if you're a small community and you're a smaller community hospital, accesses by coworkers to each other's information might be something that you consider a high risk, or access to family members' information. If you're in a larger metropolitan area, that may still be a risk for you, but you may think that a higher risk is access to those high-profile individuals. So it really is tying it back to what you're looking for. And I think if you refer back to Michelle's slide on the audit plan, one of the things that she put in there and suggested, which I think is something that could be a good way to approach this, is you don't audit the same thing every month. You audit perhaps different things each month of the year, and that's your audit plan to do that evaluation. Because remember, an audit, if you look at the pure definition of an audit, is evaluating whether the controls are working. And that doesn't necessarily mean auditing the full month's worth of data for a particular item. You could do that, obviously, but all of this is to say, I don't know that there is a specific criteria around the question that's being posed. And Michelle, I don't know if there's anything you'd like to add to that.
I just wanted to chime in and speak to what we're seeing in terms of the industry best practices or the timeline associated with that question. Because when you think about bringing up your proactive audit program for your first 3, 6, 9, 12 months, you may be focusing on one proactive audit per month as you're acclimating your system and your team and your processes to what are the associated findings from looking at users looking at their own medical records, or neighbors looking at their own medical records, or paying particular attention to a specific business associate type or high volume types of users. So as you're bringing up all those different types of reports, if you will, or alerts within your particular audit tool, you want to make sure that you mature each of those types before you go on to the next. And then as you think about maybe the second half of the year and into your second year of your program, we're seeing different outcomes with different clients. So then you can be more comfortable with, you started the program, you have that rotation going in terms of everybody knows how to hand off the ball on back to the soccer field. They know what they're doing to kick the goal, so to speak, on handling of the findings, the analysis, and the incident handling program. They're more comfortable with ramping up the program to 2, 3, 4, 5 reports per month. As Marty spoke to, you don't necessarily need to audit an entire month's of data. You could pull in different types of reports to look at different facets of what's going on from the prior month to really gain that knowledge of what happened last month, for example. So I believe, to answer the question, number one, it needs to fit with your organization from a size and scope perspective and your reference or your resources, but also where are you within your program, your timeline, what can you manage in terms of findings, and as your program evolves, the knowledge of the expected user behavior within the medical record is going to be one in which you should only be in that medical record if you have a legitimate business reason for doing so, and or we know what happens based on water cooler conversation, what happens when people don't play by the rules within this organization. So things might change as a result of the maturity of your proactive audit program as well.
Thanks, Michelle. Our next question for Tim is, can Security Audit Manager monitor ancillary clinical systems like EEG, ultrasound, and other such equipment?
The short answer is yes, but there's a caveat to that question. Any clinical systems like an EEG or ultrasound system will typically tie back to some sort of EMR or data repository, or it could be a PACS system or something like that. It's actually not as much the clinical equipment like the EEG machine or the ultrasound machine that we would audit. It's the audit logs that are generated by the users who are taking the EEG data and putting it into the EMR or into that PACS system. The key element to remember with Security Audit Manager is that we pull audit logs. So if there is an audit log on that system, whether it be on a local machine or whether it be in an EMR system, we can bring that into Security Audit Manager for auditing. A lot of actual EEG, ultrasound, and other equipment type machines, they won't actually tie their unique audit logs to a patient or to an individual. That happens at the EMR or PACS level. And it's at that PACS level that we find the most valuable auditing data. So the short answer is yes, but there's a lot of things to consider there.
Thanks so much, Tim. And we have time for one more question, and this question is for Michelle. What are some reasons for explaining to staff why they cannot access their own record?
That's a good question. I know there's been an article that was published in Compliance Today, one of HCCA's magazines, and it spoke to that slippery slope of when you're in your own medical record, what else are you finding time to look at? And thinking about, if you want to address the user's activity on policy violations early on so they know what the appropriate standards are for the organization. There can be numerous reasons why you want to speak to not accessing your own medical records. It could be, do you have controls in place where when you're in your own medical record, could you change anything? Could you modify your own medical record from a billing perspective or from a diagnosis perspective? Do you have those controls framed around it? When it comes to, from maybe an HR perspective, do you have any concerns on or around productivity? Is if you have time to be reviewing your medical record, then are you doing your job on the workforce? And that's perhaps not something a privacy or compliance officer wants to touch with a 10-foot pole, but there's so many elements to should the user be in their own medical record that it's certainly a business choice, but many organizations are choosing not to, and they have policies that surround no access to your own medical records. We ask you to go in through the patient portal, and there's a reason for that because we hired you to be on the workforce as this role. I hired you to be a technician, and when it comes to looking at your own medical records, you're then in the role of patient, and as patients, you need to follow the same protocol that we have for our patients. So not an easy question to answer. There's certainly many elements to pursue, but those are some ideas that come to mind as I think about conversations that we've had with our clients.
And if I could, I'd like to add a couple other pieces to that. One is if you look at the regulations under HIPAA on what the patient has the right to access, there are certain elements in there that the patient doesn't have the right to access. So one of those is if there's been the promise of confidentiality to a third person who gave information that ended up in the medical record, then you have to keep that confidential and the patient's not entitled to see that. And if I have the right, if you allow me to look at my own medical record and that kind of data was put in there, I don't actually have the right to access that, but my ability to view the record as an employee might be such that I could look at that information, and now you've potentially violated that agreement with the third party. And the example here is, if I go to an office visit with my husband and he goes out to get lab work done, and I turn to the physician and say, I think it's really important that you know this information, but I don't want him to ever know that I shared it with you. And the doctor says, certainly I'll not share it with him, but he or she records in the record that I gave this information to them. They promised me some confidentiality. My husband actually is not entitled to get access to that information in the record. And so you could potentially be creating issues around that type of thing if you allow individual access. And then in particular, I happen to be in the state of California today, and I know the state of California has a lot of represented employees, union employees. And there's been some discussion that I've been part of where if I have access to the EHR or certain portions of the EHR, which would permit me to look at my own record, but I have a colleague that doesn't have that same level of access because that's not appropriate for their role, they now have more rights, or I now have more rights possibly than they do, and that creates some disparities. And again, it goes back to Michelle's comment about that's really an HR issue. But as you think about your policy on whether or not you're going to permit employees to access their own health records, there's nothing that says you can't. And if that's your policy, then you don't need to do any auditing of whether the individuals access their own records. But there are substantial numbers of considerations in coming to the conclusion of whether you will or will not permit employees to access their own health records.
Thank you so much. And with that, we'll close our webinar. Thank you all for attending today, and thank you all for our presentation. We really, really appreciate it. As a reminder, you can take our survey for a chance to win a $100 Amazon gift card. Be sure to follow us on social media and check out our blogs for healthcare IT updates and to interact with your peers. If you'd like more information, please contact your Iatrix Systems account executive or email info@iatrix.com. Once again, thank you everyone for attending, and thank you to all of our presenters. We hope you have a great